We've used that time wisely. We've had the chance to get a head start on vaccines and therapeutics. State and local governments and healthcare providers have had time to prepare. We've been able to start ramping up procurement and manufacturing of personal protective equipment like respirators. We were able to formulate a strategic, evidence-based supplemental funding bill, which the President signed into law on Friday. And we've been extremely focused on expanding our testing capability and capacity. By the end of this past week, 1.1 million tests had been shipped out to public health laboratories and private labs and hospitals. These were made by the CDC and by a private manufacturer. At this time, another 1 million tests are available to fill orders or are being shipped. This private manufacturer and a number of other private manufacturers are ramping up production of their tests such that they will have produced an additional 4 million tests by the end of this week. We have always been able to meet the full demand for test orders from public health officials. At no point has a request for a test from a state or local public health department been denied by CDC, and at all times CDC has had capacity to run these tests either itself or through other CDC public health reference labs. I want to emphasize how successful we have been at detecting cases. America is not a country where a case of unknown influenza-like illness goes ignored. Our healthcare providers are working swiftly to identify cases. Thanks to the early warning that we sent out to America's healthcare providers. That's how we identified those initial cases, and that's how additional cases are being identified throughout our system. And we're responding as needed with a multi-layered approach. We've been extremely pleased with the constant productive communications we've been having with our nation's governors in particular. In short order, we will be releasing further guidance about what state and local governments, employers, schools, and families can do and should do to mitigate community spread under various types of circumstances. At this time, the immediate risk to most of us as Americans from COVID-19 remains low. But that risk can be higher for those who may have exposure to individuals who have confirmed cases or for those who have traveled to affected areas. In addition, we now know from the progression of the disease globally that older people and people with serious chronic medical conditions are at higher risk of serious illness, including death. Conditions that raise the risk can include lung disease, cancer, heart disease, stroke, renal disease, liver disease, diabetes, and immunocompromising conditions. The CDC has put out guidance to remind people who fall into these groups and families who live with them that they should be taking particular actions to prepare and to protect themselves. On top of avoiding contact with people who are sick, washing their hands often, and paying attention for particular symptoms, older Americans and those with serious underlying conditions should avoid crowds and places where people gather in groups, especially in poorly ventilated spaces. Information like this can be found at coronavirus.gov, which also has guidance for families, employers, and schools. I want to conclude this part by emphasizing that if you are involved in running a healthcare organization yourself, you should help review the plans that you have, lean in on preparedness, and be ready to execute on any necessary action plans. I want to encourage organizations, as needed, to be in touch with us through our Office of Intergovernmental and External Affairs. Now I want to turn to the planned topic of today, which is the future of biosimilars as a path to saving for the American healthcare system. Focusing on this issue shows that all of you recognize a trend that still may not get as much attention as it should. The dramatic growth of expensive biologic drugs as a share not just of drug spending, but of healthcare spending, period. Today, biologic drugs represent almost 40% of prescription drug spending, and that number has been steadily increasing. According to one estimate from 2018, we spend on net $125 billion a year on biologic drugs. America's biologic spending alone is as large as the entire economy of Puerto Rico. Yet the share of that biologic spending that goes to biosimilars is depressingly small. According to the same 2018 estimates, just $1.9 billion a year. Today, in fact, only one biosimilar product has more market share than the reference product. Only one. Now, these are discouraging numbers. They discourage me, but there are clear reasons for hope. First, in many ways, we've been here before. Senator Hatch led us through them. It took a great deal of time, provider education, and gradual cultural acceptance for generic drugs to have the dominant market share that they have today in the United States. When we surmount these barriers for biosimilars, the benefits will be huge. Imagine doing to 40% of the pharmaceutical market, even some fraction of what generics have already done to the other 60%. Second, we know biosimilars can succeed because so many other wealthy countries have made them work. Countries that take an essentially command and control approach to health spending, essentially where the government can shift share by just dictating which product they're going to use, they've already seen significant savings. According to the Biosimilars Forum, 90% of global biosimilar sales happen in Europe, even though the U.S. accounts for 60% of global biologic sales. We deliver faster access to new life-saving therapies than European health systems do. But delivering the true benefits of those innovations also means equally aggressive work on pro-competitive measures to drive down costs. We're setting our sights high. To deliver these kinds of benefits, the goal is and has to be pharmacy-level interchangeability once the data and science support it. Real progress is being made all the time, and there's a great deal of benefit that we can deliver before we get to FDA's standard of interchangeability. In 2019, we saw a historic year for biosimilar approvals, with 10 products approved, up from 7 in 2018 and 5 in 2017. We also saw more biosimilars enter the market, including products for cancer, Crohn's disease, and arthritis. Efficient review and earlier marketing of approved biosimilars have been the direct result of actions by FDA under its Biosimilars Action Plan. In November, FDA released a draft guidance to help support development of biosimilar and interchangeable insulin products, one of the most common biologic products and a significant cost for many Americans with diabetes. Further, in February, FDA finalized its rule around the definition of a biological product, which is intended to clarify the statutory framework under which these products are regulated. We also have the upcoming March 23rd transition of certain biological products, which had been approved as drugs, but now will be defined as biologics, to regulation under the Public Health Service Act. This is an opportunity for more competition and lower costs, because it will create the first ever application pathway for products that are proposed as biosimilar to or interchangeable with these transitioning products. FDA also recently updated the Purple Book, making it easily searchable for the first time. We also know that it's not just regulation, but also economics and payment incentives that are holding back biosimilars. We've sought out every possible avenue we have to fix that. In 2017, CMS began giving each biosimilar product its own payment code within Medicare Part B, and in 2018, we began allowing Medicare Advantage plans to have beneficiaries start on a biosimilar product before trying the branded reference product. We've already seen major insurer plans put these tools to use, reducing costs for the taxpayer and, importantly, reducing out-of-pocket costs for patients. We're also looking beyond payments and regulation. FDA recently finalized new policies to make it harder for brand drug companies to use citizens' petitions to prevent biosimilars and generics from coming to market in the time frame that the law had intended. Then, this past month, the FDA and the Federal Trade Commission signed a joint statement agreeing to take a number of pro-competitive steps. That includes deterring behavior that impedes access to samples needed for biosimilar development, taking appropriate action against false or misleading communications about biosimilars, and having the FTC review patent settlement agreements involving biologics for antitrust violations. We're pleased that the FTC is strongly committed to promoting competition and fairness for consumers in this space, and we look forward to working closely with them on action where appropriate. This work to stop gaming and anti-competitive practices got another boost when the government funding bill signed by President Trump in December included the CREATES Act, which is estimated to save taxpayers and patients billions of dollars through lower costs and more competition. We also call on Congress to act on the broader historic opportunity it has to boost competition and lower costs by passing bipartisan drug pricing reform. The last time the Congress was this close to making a meaningful dent in Americans' drug costs, they did it by passing Medicare Part D, and in no small thanks to Senator Hatch's leadership. While the Grassley-Wyden legislation supported by President Trump does focus mostly on Part D drugs, it also would include a number of changes expected to increase biosimilar uptake. It would increase Medicare Part B's reimbursement for biosimilars to ASP plus 8 for 5 years, which we think could help us speed over some adoption hurdles. It would also require us to add a measurement of access to biosimilars to the star rating system for Medicare Advantage products, a topic that we've raised in requests for information from CMS. What I've laid out for you are a number of important actions that we've taken and are considering to get where we all want to be: a truly competitive market for biosimilars that delivers American patients and American taxpayers lower costs. I want to encourage all of you to come to us with more ideas that you have. Our door is always open, and President Trump is always open to ideas that can lower costs, drug costs, while keeping patients at the center of our system. I believe when you combine the President and his administration's commitment with the clear consensus around the importance of biosimilars from Congress and healthcare payers, that we are nearing an inflection point. Americans are demanding lower drug costs and lower health care costs, period. They have a president who's intent on delivering that and who is unafraid to take on powerful interests to make that happen. But we can't succeed without sustained attention on these stubborn challenges, and that's where all of you come in. So thank you for the work that you all do in healthcare. Thank you for your work bringing down drug costs for Americans who need it most. And thank you again for having me here today. It's great to be with you. Thank you.
Thank you again, Secretary Azar. In light of the current public health situation, you no doubt have countless demands on your time. We sincerely appreciate your being here. We likewise appreciate your service to the country and the commitment to expanding access to life-saving medicines. Before we close, we'd like to also thank Pfizer and the Biosimilars Forum for their support of today's program, as well as the many speakers and panelists who have joined us. Thank you for the deep insights you've brought to this symposium, as well as your efforts to shine a light on the value of biosimilars and their important role in our healthcare system. Our mission at the Hatch Foundation is to find bipartisan policy solutions to our nation's most pressing problems. With your support, we can continue working toward a better future for all Americans. We hope you've enjoyed today's programming and will consider joining us for future events. Thank you and enjoy your lunch.